Welcome, neurosurgery residents, to your neuropathology course in the DM Neurosurgery. This is the start of your year 3 and semester 1 in your DM Neurosurgery program. This course will last for 12 weeks and go through the entire semester 1. First of all, congratulations on being successful in your DM Part 1 surgery, completing your 4 courses and now progressing on to the real neurosurgery courses and spending some time in the neurosurgery program. My name is Dr. Robert Ramcharan. I'm the consultant neurosurgeon at Port of Spain General Hospital and the program director. This is Dr. Devendra Ramnarayan. He's a consultant neurosurgeon at the Eric Williams Medical Sciences Complex and the program director. Dr. Sheba Barrow is our pathologist and neuropathologist. She's an associate lecturer in neuropathology, and she will be taking care of you guys in the neuropathology lab and giving a few lectures on some of the neuropathology cases and some lesson plans as well. So our neuropathology course consists of 10 modules, each module being 1 week long with learning objectives attached to the learning outcomes. These learning outcomes are very well stated here and given 1 per week. There are 2 revision weeks within the course. You will become familiar with these learning modules later on as we present our course outline and different assessments will be given for each module. You will be expected to complete the assessment when stated, which will be either at the end of the module week or on some occasions at the end of the semester. All assignments are eventually due by the end of the academic year, even for late assignments. If the candidate is unsuccessful in the assignments completed during the semester or during the module week, they will have 6 months to hand in a complete and successful assignment. After the 6 months, if the candidate does not pass, they will be asked to repeat the rotation. Therefore, we do emphasize that you try and complete your assignments on the due date. If you, for some reason, you're unable to, you still have 6 months to repeat it. However, we will not be extending this beyond 6 months. During your course and program, you will be allowed 1 extra year to complete the program. According to UE guidelines, this cannot be extended unless you get explicit permission from your program director and your specialty board at a specialty board meeting. During your semester, you'll be expected to conduct ward rounds on the patients at least once a day or as needed, which include working with your neurosurgical team, other team members of the health system, and helping manage these patients. You'll be expected in the outpatient clinic department, in which we have 2 a week, which will be half-day sessions. All residents are expected to attend these. You'll also be expected to be in the operating room and operating theaters, in which we presently have 3 operating rooms per week. The resident will be expected to know the patients pre-op, help with the surgical procedures, manage the patients after the operation, and write up the operating notes. As you get more experience, the resident will be able to assist in more and more operations. We expect that you keep a comprehensive logbook of all the operating cases that you have done. Our teaching for this course will be blended in nature, and it will consist of classroom teachings, which are going to be face-to-face, online teachings, which include Zoom meetings and online discussions. All the lectures, PowerPoint presentations, and papers will be available on My Learning, and you'll be expected to peruse this before classroom sessions and online sessions so that we'll be familiar with the content. We will state exactly what you should be familiar with before each content. We expect to have 2 teaching sessions a week, and these can either be face-to-face and classroom or online. We will emphasize more of the online teaching, which will more facilitate the residents that could be at different sites and allow them to continue with the clinical work with their teaching going on. We expect full attendance at all clinics, ward rounds, operating theaters, and lectures. So everyone, good luck in the rotation. I will be always available to ask any questions. You shall see me on a day-to-day basis, and you shall meet Dr. Devendra Ramnarayan as well, who will also be available to ask questions. Good luck, and looking forward to see you guys for the next 6 months.